So what is the difference between a doctor and a pharmacist? What does a doctor do and what does a pharmacist do? Let's talk about that. See, doctors actually do go to school for 8 years, but then they also have 4 years of internship, and then they usually have fellowships. So it takes them a lot longer to get through all of their schooling. Pharmacists go to 8 years. So what we do, we go 8 years. And how does it differ? Well, doctors diagnose. What does that mean? They look at what you have, they go through your history, they check you out, and then you as an individual, they say, this is what you've got. I don't do that. That's the reason why everything I do starts with if. I don't know what you have. You need to find that out. And the best way is from a doctor. Second thing doctors do is they prescribe. That means they look at you, find out what you have, diagnose you, and then write you a prescription and say, go get this stuff. I don't do that either. But what pharmacists do is if somebody says, this is what I have, what should I take? We're real good at that. You see, pharmacists spend 195 hours in pharmacokinetics and pharmacology while they're in school. Doctors do about 40, and that's because they have so much stuff to go through. They have to get real good at a lot of things. They have to do procedures. We don't do procedures. They have to do a history and physical. We don't do those either. We don't do that stuff. So we spend our time on pharmacology, how they act, how do they react, right? There was one test that we did where we had to memorize 2,000 excipients. That's the stuff that you have inside medications that are inactive. And you had to pass that test with an 85% compliance, meaning you had to get 85% of them right. Well, that teaches me what compounds do what and how they do them. And that allows me, when somebody comes in and says, I've got this problem or that problem, for me to know what they're looking for, right? Also, we can recommend. We can recommend things that work. We can say, hey, you've got allergies, we can do this. They say, I have this disease state, what should I use? We can recommend on that too, right? I actually have daily, I have doctors come over and say, okay, I've got a patient that has this diagnosis. I've tried these 3 things. What's next? That's where we step in. So with a lot of my videos, I'll start out saying, hey, if you've got this, not saying you do, here are your options. And that's exactly what a pharmacist does. Doctors, on the other hand, their jobs are real hard because they have to be able to look at it, diagnose it, know why your bumps went from red to purple, figure out how long they've been there and what it is. That we don't do that, but we do have a lot of knowledge about what to do next. So once they diagnose you and say, here's what we need, that's where the pharmacists step in. And hopefully some of this stuff will help you now that you've been diagnosed, in particular when you're waiting to get into your doctor to figure out what's next.